Welcome to this latest video from DPP Planning. The response to the pandemic by the NHS highlighted the adaptability of our health services, which included creatively using the facilities they had available to cope with COVID cases and also, as much as possible, maintain the care of other patients. Fundamental to this is the effective estate management and the development of a strategic plan to develop new facilities within budgets. Joining me to discuss this is Jen Patterson, Associate Director at DPP. Hi Jen.
Hi.
Hi. So firstly, what are the main challenges facing NHS trusts when it comes to estate planning?
I would say resource, both in terms of funding and availability of land and property. A lot of the NHS is operating out of significantly life expired buildings, so they're all, or a lot of them, in need of refurbishment or demolition and rebuild. So the NHS has to think creatively in terms of how they use their land and resource, which is finite. They've only got a certain amount, and they need to be able to maximise the land and property that they do have to provide those sort of high spec, modern, fit for purpose buildings that are both good for staff well-being and also obviously aid patient recovery.
Some of these issues that you're talking about there, finite use of space, obviously budget, which I mentioned in my intro as well, these aren't unique to the health sector. So where else has successful estate planning in the same way been applied?
Yeah, absolutely. So we have assisted universities, a couple of universities in their strategic estate master plans, both Durham University and Cardiff University. So we've helped them develop sort of 5, 10, 15-year master plans to review their estate. We'll do a sort of comprehensive estate review, look at each of the buildings, sites that they've got, and give advice on where the main planning opportunities are, where the main risks are, and just feed into that development process so that I suppose they've got a clear picture of what they can and can't do, what's going to be possible, what might be tricky, to help them bring forward their strategy, both academic and residential. So the same principles apply, or similar principles apply, in terms of planning when it comes to different institutions like NHS trusts, for example.
So yeah, so you'll have within an estate team at the an NHS trust, project managers and various people who have an understanding of those sort of how they run their estates and develop it, but maybe not so much planning. So what are the benefits of bringing in a planning consultancy to help them develop those plans and implement them as well? I
suppose similar principles apply whether it's universities or health trusts, but essentially the plan-led approach can help manage transition and change. It identifies where there are huge opportunities for development and where projects might be slightly riskier. Then also for us, knowing those areas which have those potential for growth, we can then really help support those institutions, sort of adding value, maximising and managing planning risks, and just ensuring that when developments are applied for, that the right consent is obtained, and then having a planning consultant on board also helps bring those projects in on time and on budget.
Okay, so one of the government's post-COVID plans for the NHS is more diagnostic centres, treatment centres, things like that. So how do they fit in, or how should they fit into the Trust's estate planning plans?
I think so the elective treatment centres probably need to be more within the hospital estate, so that they've got the personnel there as well as all the equipment that's needed. Diagnostic centres are sort of actually happening across communities and in different locations, not necessarily within sort of principal hospital estates, which is meaning that sort of empty units within high streets can be used, and just I suppose just using available land and buildings for those purposes. If they're in high street locations, they're obviously quite accessible, which is key when you've got high numbers of people.
And if they are in town centre or city centre locations, which would be great, a way of doing a bit of sort of urban regeneration in that way and getting city centres used for things, getting people back in and that sort of stuff. But then surely there are planning considerations that would not necessarily be primarily in the front of people's minds if they're on the existing hospital or NHS trust site. If you were to build a diagnostic centre in the middle of a town,
Yeah, absolutely. So those changes of use would need to consider neighbouring uses and just make sure that they could sort of coexist quite well together. I suppose transport implications and making sure that people can get to and from those locations, whether there's ambulance drop-off that's needed or parking or good bus links. It's just, I suppose those are probably the primary considerations, but all the usual planning considerations will still need to be assessed as well.
Are there any projects that DPP are working on in this area at the moment?
Yes, so we are supporting the Newcastle upon Tyne Hospitals Foundation Trust with their growth strategy. In terms of sort of post-COVID recovery, we are assisting them with an elective treatment centre at the Freeman Hospital. That's being developed under the emergency permitted development rights that were brought in through the sort of coronavirus legislation. So the elective treatment centre is being constructed under those permitted development rights, but we've advised them on what they can do under permitted development, and we've also liaised with the local planning authority on that as well. I think one thing that trusts need to be aware of is that emergency legislation for permitted development is time limited, so it's just been extended to the 31st of December 2022, but beyond that trusts will need to understand how they can keep those buildings in the long term.
That's great, Jen, thank you very much. And if you want to find out more about DPP's work in the health sector and indeed other industries, please visit the website and look out for more videos soon.